everyone. Welcome back to my podcast. This is the We the Africans podcast, and I release a video and an audio for you every other Sunday. So you can watch this on my channel, The Simple Pharmacist, or you can subscribe to it on iTunes, Google, CastBox, Spotify, iHeart Radio, and Amazon. So feel free to check it out, and please leave a good rating in the iTunes store so more people can discover this podcast. So on this podcast, I have my friend and a very special guest, Jewel, and her name is Dr. Jewel Sandy. Hi, Jewel.
Hi, Nyoma. Thanks for having me.
Thank you for being here. This is going to be about Jewel's journey to becoming a master ophthalmologist, and she's going to talk to us a bit about that. But before we do that, we always have a segment on this podcast called Swamp Tales, and that is where I share with the world my disdain for all things Floridian. So I'm going to share my screen with you so that you can see what is happening in Florida. So this is like actual news stories from Florida, so that you can actually
Oh
see
boy.
the nonsensical nonsense that happens there. So here we are. Here is this story called Florida Man Charged with Disorderly Intoxication After Allegedly Shoving Spaghetti into His Face and Threatening Employees. So the man
What?
basically followed an employee of the restaurant and threatened the restaurant employee. And then when the employee went back inside to call the cops, this guy followed the employee inside and asked what kind of genitals he had. And then when the cops showed up, they found him sitting on a bench near the front door, shirtless and shoving spaghetti into his mouth.
Into his mouth.
Yes,
Wow.
yes,
Only in
disorderly,
Florida.
only in Florida. And they have
You
so
know, it's so
many.
fun. Yeah, it's so funny. I was watching Trevor Noah, and he was making a joke about the new um is a treatment that they have to eradicate like malaria causing mosquitoes, and they were doing a test
Yes,
in Florida, and he was saying, if there's gonna be like some mutation or something go wrong with the population, you won't really know because Florida, they're already kind of
they're
crazy
already
as
out
it is.
there. Yep.
They're already out there. You don't know. It's like, well, this could just be regular Florida people,
Yep.
or this could be something else going on, some genetic mutation. I thought that was really funny. So this
It's the
case in
truth.
point.
Yeah. Because, like, if you're doing a drug trial and the adverse effect is like, oh, mild rash, you're like, oh, this isn't bad. We can continue. For Florida, the equivalent of mild rash is extreme insanity because they're already
Right,
there. So you're just like, okay, so nothing changed.
right.
Baseline is still baseline.
Nothing changed.
Yeah.
We're not really sure if this is actually an adverse effect or, just normal
Just another
for these
Tuesday in
people.
Florida. Yes. So that's our
Uh,
swamp tales.
yeah.
See, I'm glad to share these things because I need people to understand when I talk bad about Florida, it's coming from a place of truth. It just is.
It's informed. It's informed.
Yes. Okay, so on to our main story. Our main story is about Dr. Jewel Sandy. So, do you want to give us a little bit about your background, where you're from, and how you came to be in the United States?
Sure. Yeah. So I'm from Sierra Leone, country in West Africa, which you should know if you're listening to this podcast. And I was born and raised there. I left there when I was about almost like 2 weeks shy of my 13th birthday. Basically, my parents came here to further their education. My mom was working for an NGO called Plan International at the time. They build schools and wells and things like that. And she got a scholarship from the World Bank to study public health. And because we're Seventh Adventists, as part of our faith, they chose Loma Linda, which is a Adventist institution in California, and that's how we got here. So my mom came here first, and then my siblings and my dad joined her a few months later. Shortly after we left Sierra Leone, the civil war got really bad. The capital, Freetown, where we were living, was overtaken by the rebels, and so we couldn't go back even if we wanted to. So my parents, after finishing their studies, stayed, and we were fortunate to win the lottery, get a green card, and yeah, that's how we stayed and got here. Yeah, definitely Providence in the way things worked out. Let's see. I had wanted to become a physician from a very young age. What really fueled my desire is the paucity of healthcare I saw when growing up. I was acutely aware of just long lines at the hospital. Like I used to get malaria like 4 times a year. It was terrible. But
Wow.
sometimes, yeah. So I was very familiar with chloroquine because that was the main treatment at the time. But
That
yeah,
bitter
sometimes
taste
I'll
in the
get
back of
really
your
sick.
tongue, you'll never forget it.
Terrible.
Mm.
Terrible. Yeah. I was like, let me just keep throwing up and feel horrible. I don't want to take this thing. But yeah, so I had to go to the hospital at times, and it was always such a daunting experience. It just took forever to get seen, and I don't know. Even as a young child, I just felt like, man, this is not good that there's so many sick people here. And I was inspired personally by my uncle, who was the equivalent of a physician assistant, and he lived in Masanga. It was a mission hospital, which was a few hours from the main city. So we're going to see him. Sorry, he
Oh yeah, you. Sorry, you said you'll go and see
he
him
had
when?
during holidays, like summer holidays.
Okay.
So there'll be like a line of people around the block, like waiting to see him. And I was just so impressed with the care and just the hope he brought to people. Like people come in with just worried faces and will leave with some relief. And I'm like, I want to be a part of this. But that was a far off dream for me, just with the status in Sierra Leone, the uncertainty with the civil war. So really moving to the States made the possibility of that dream becoming a reality. Um,
Wow.
yeah.
You know, it's funny when I hear doctors like you, like my sister is one of those people that has that heart for like when she sees, medical things that are wrong, they just want to fix it or provide some relief. I mean, I'm like, I've been in the same situations where I've seen things and I'm just like, this is crap. I want to get out of here. Like my thought process does not include, let me go to medical school and try and provide some relief because I'm just like, I don't want to touch nothing. I don't want to see nothing. I don't want to smell nothing. Every time my sister talks about like dissecting cadavers, I'm like, you can stop now. You could have stopped yesterday, actually. So you guys are just amazing to me
Yeah.
because my brain doesn't do that
Well, it's
at all.
okay. Our brains all have strong points. So
Yeah, I still remember vividly like going on my residency rounds and the doctor had a patient with like morbidly obese with cellulitis all over his body and the smell. I
mm,
walked in, he was like, we're gonna examine, and I walked out. I was like, this is not for me. This is outside my scope of practice, and we're done here.
not your story.
Never
Yeah,
again. So
it's tough, but I think when you see something so wrong fixed, like it's a rush. It's a high almost, like being able to
oh, you're
like
going in and out. Sorry.
there's the emotional part of it, you know. Oh, is this better?
I think so. I think
Okay.
so. I hope it doesn't keep doing that.
Yeah, but I think in general, yeah, some people just, some things excite some people and others it puts them off.
Yes. I'm
So
the
it's
latter.
one of those things.
Okay,
Yeah.
so what was your medical school journey like in terms of which school did you go to and what was the diversity population like within your class?
So I went to Loma Linda University, School of Medicine. I chose Loma Linda primarily because of my faith, and it's a faith institution. And Loma Linda being the place where my family first moved to when we came to the States, I had a strong connection here as well. Not a very diverse program though, to be honest. There was like I think 9 of us, 9 Black specific people in the class, and that was out of a class of 175.
Ooh,
And that was the largest group of Black people they'd had in the history of the School of Medicine up to that point. Yes. Yes. So the class above us, they had two dose, 2 people. Yeah. So for us, like having 9, it was like, wow, there's all these Black people here. As far as other races, I would say there was probably a really smaller group of Hispanics, and the rest were mostly white and Asian.
yeah.
So those were the predominant groups. For me, it wasn't such a shock because I was coming from University of Colorado at Boulder,
Even wider.
which at
Wow.
the yes, exactly. Which at the time was one of the widest like public schools in the country. So for me, I was just like, okay, so this is just business as usual. Not a lot of black people here. Overall, I would say my medical school experience was good. I mean, medical school is hard, and it's hard for me to compare to other programs because I only lived through mine. The positives were being in an institution of faith, there was opportunity to focus on the non-medical part of healing, the spiritual part of healing as well. We had courses in this, and we also had doctors who embodied this and who can model this for us. And I thought that was helpful. I think what was most helpful was being around like-minded individuals who also saw, medicine as a calling, and we can encourage each other in prayer and uplift each other as we went through this journey. So I thought that was a big blessing. So I thought that was really good. I do think that the entity, Loma University, is realizing the need for more diversity, as I'm sure a lot of institutions are. And when I look at the current class, they've definitely made strides towards that. There's still a long way to go, but they're moving in the right direction. So
Yeah, that's good to hear. So what about in terms of, since it's already such a small Black population, I'm sure it's even an even smaller, like directly African population of students in the class. What about like the professors or any kind of mentors or practicing physicians that came through? Did you have anybody that, other than your uncle, did you have anybody that you could kind of go to for help that you felt super comfortable with, that could kind of understand where you're coming from, that was of the
no,
same, complexion?
yeah, no, and it's the short and quick answer no. There was definitely a paucity of mentors in general, I felt, but specifically people that were of minority and Black. I am fortunate in that my uncle is a physician as well, and he was actually doing his residency at the time. So there was some guidance there. It's hard when you're a resident because you're also going through the thick of it, but that was helpful. But it was really tough. And I think you don't know what you're missing, I guess, until you sometimes look back and realize that would have been really nice to have that. But I definitely struggled with figuring out what I wanted to do in medicine in terms of specialty, understanding. I mean, doing your schoolwork and being smart is great, but a lot of your success with medicine also has to do with networking
Right.
and understanding, the resources that are available to you. And mentorship really helps you take a hold of those or even just become aware of them. And so, yeah, that was tough not having that. And yeah, I think there's a lot of need for that. It's really hard when you already have such a small percentage of providers being minority or from minority background or being Black, much less African. And you can connect with other people. They don't necessarily have to be your color for them to connect with you, but it's just an easier, I think, relationship to build because you already have a similar experience in some way. And you've already experienced similar challenges and get to the point where you are in your career. And so it's so much, I think, nicer, even just to see, just to have someone to look at, when you're on the wards, like they look like me.
Yes.
It's an unconscious thing, that subconscious thing that happens where when everyone else looks different from you, well, you start feeling like you don't belong or there's something amiss here. Like,
Right.
you just, and I think sometimes when you have dreams or envision yourself in the future or set goals for yourself, it's really hard when there's not a model that you can look at to then
That's
set
true.
those goals and reach those heights. So yeah, that was tough.
Yeah, because representation, people do not understand just how much it matters. Like for me in pharmacy school, the vice dean was a Black woman. She was an African American woman, and she was the only Black teacher, the only Black professor that we had. But I would literally feel very comfortable walking into her office. Like I would pour my heart out to her and say, like, I actually need scholarships. Like, tell me what I need to apply for. And I knew that she was going to at least understand at baseline that I'm coming from a different background than the majority of the other students who were white Americans. So it helps tremendously just to have that vision in front of you, because it helps you just think to yourself, if she's done it, If he's done it and they
Mhm.
look like me or they come from a similar background, then there is an absolutely good chance that I can also do the same thing. So yeah, definitely don't take it for granted. Yeah. I
Yeah,
think that
that's a blessing.
people that don't understand when we say that, it's because you've grown up literally seeing yourself represented in every arena of life, on screen and off
Mhm.
screen. When you think about a doctor, in most people's minds, they see an old white man till today,
Mhm.
because that's all that's been presented in the media. So it's a huge, huge advantage that they have over us. So yeah, you're right. It's absolutely helpful to have that presented in front of you. So, why did you choose ophthalmology? And for those that don't know, ophthalmology is, an eye specialist.
Yeah, so ophthalmology is a field of medicine that addresses eye diseases and all aspects of it, both the medical and the surgical. And I kind of stumbled into ophthalmology. So I think, I came into medicine thinking I was going to do pediatrics because I love children. And yeah, I was like, it'd be great to like fix them. And then during my first my first couple years, I really like first year I really enjoyed anatomy, dissection, and I kind of started thinking more about a surgical field. I know, gross for you. Um, but and then we learned about the brain, and I was fascinated with the brain, and so I started leaning more towards neurosurgery. And I remember I'd read, Ben Carson's book Think Big
Gifted
when I was
minds.
in Sierra Leone as a child. Sorry, what'd you say?
Is it Gifted Minds? Is that the one? Gifted Hands. Gifted Hands. I think that's the
Gifted
name of the
Hands.
book. Yeah.
Yeah, yeah. Or was it Think Big? I can't remember. Maybe I read both. I don't remember. But anyway, very impressed with him and his story, and I was engaged with what I was learning. So I did research in neurosurgery and was all about it. But in a surgical rotation in our third year, we had to do a week of ophthalmology. It wasn't a choice. And during that week, I got intrigued. So my experience up to that point of ophthalmology was what we'd learn in lectures, and then we had to do an exam with a direct ophthalmoscope where you have to get really close to someone, almost like you're kissing them, to look in their eye. And you're looking through a very small hole or aperture, and your view is kind of limited. And so I was like, I'm not trying to do this all day. Like, this is not the business. But that was my very limited understanding of ophthalmology. And so during this week, I got to, examine patients in the microscope, which is more standard. A slit lamp is what we call it. I got to see eye surgeries being done. And I was really fascinated. I mean, it was exciting to be able to look through an instrument and be able to actually see a blood vessel like pulsate, like you actually see the blood vessel. It's not, through an imaging, it's not, you're not feeling it, but you're physically seeing it. So I thought that was really incredible. People say the eyes are the window to the body, and it literally is. Like you can see the body by looking, through the eyes. And I was fascinated with the surgeries. I'd just come from general surgery. I was retracting bowel for like 6 hours, and here you have a surgery while you're sitting down. And it's really elegant, and the surgeries are relatively quick, and within minutes you've transformed someone's life where they couldn't see before, and then they could see. And the response of the patients after surgery was just such like sheer joy and gratitude, and the reward is instant as a surgeon. It's like right there. So I really like that. I thought to myself, I would like to be a part of bringing this type of joy into people's lives. And so it took me a while to finally decide on it. I did a couple more rotations through it, but ultimately I realized it had everything I liked about medicine. It had surgery. It's also a surgical field where you see patients over and over for certain chronic conditions. So you get to develop a rapport with them. You have opportunity to do health education, for example, with diabetes and hypertension. And then you can also do a lot in the mission field. So, coming from Sierra Leone and wanting to meet an underserved population, ophthalmology lends itself perfectly to that because you can do so much with so little. And so, yeah, I was like, this has everything I like about medicine. And fortunately, I was able to get into the specialty and do a residency in it. So, yeah.
And she's boss, people. So,
Yeah.
talking about missions, you are, girl. I'm going to give you your flowers. Talking about medical missions, how many have you done, and you wanted to help the underserved is one of the reasons why you went into medicine to begin with. But like, how do you make decisions as to which countries you go to? Do you think about like safety? How safe am I going to be? Do you go by yourself? Do you go with an organization? That kind of thing.
Yeah. So, to be honest, I don't know that I've done that many medical missions. Medical missions in general is a way to meet the needs of the underserved. And most times it's short term. People go for a week or two, meet the needs of a population, and then come back. And that definitely has its place and helps a lot of patients who are suffering. And I kind of envisioned myself doing more of that work when I was in training, as well as maybe being full time somewhere in the mission field. As I've gone through my training, I'm kind of learning a different approach to meeting the needs of the underserved, specifically with ophthalmology. I did a fellowship in global ophthalmology, which is an emerging field within ophthalmology. And the fellowship was focused on more evidence based, structured ways of meeting the need of the burden of blindness. Okay, so I'll talk specifically about ophthalmology like mission. It's more of a, instead of me as a person going or our group going for a couple weeks and doing some work, it's us working partnering with entity or the government or the local healthcare providers to work towards decreasing the disease in general. So, doing this fellowship, I spent time in Swaziland, in China, and in Nepal. So, it was a great year. And it was really good for me because up to this point, my idea of medicine is you see a patient, you treat them, and that's that. But this was a step back. You're looking at a population. You're looking at, how many people are blind in this population? Why are they blind? How can we fix the blindness? What are the barriers to preventing them getting care? And specifically for eye care, cataract is the leading cause of blindness. And cataract is a condition where the lens in the eye gets cloudy. It happens as people age. Sometimes it can happen earlier in life, but it's a condition that can be cured with cataract surgery. And that's a common procedure that's done here in the US and all over the world. But a lot of places, people can't get the care. They can't get the care because there's not enough trained people to do surgery. This is the main reason. Some of them are not aware that this can be fixed, like, especially in a lot of our sub Saharan African countries. People are like, oh, they've been bewitched. It's witchcraft that's causing it.
Because the
Or
eyes
they
look
think it's
cloudy.
because their eyes look cloudy. So they even sometimes think they're witch people, witch man. Or they think it's just a part of aging that's inevitable, that they just have to live this way. And so there's lack of education, but a lot of it is also just a lack of resources. There's no one to offer them that care. The idea with global ophthalmology is, how do we get the people the care that they need, and how do we develop systems that are sustainable so people can continue to get the care that they need and they don't have to live with blindness. So that's the kind of work I've been doing. I started when I was a medical student. After I matched into ophthalmology, I went on a mission trip to Sierra Leone. This was my first time going back since I left as a adolescent. I got to work with a British ophthalmologist there at the time. Some of the, what's the word I'm looking for? The romantic ideas I had of like going in and like saving the people kind of came crashing down.
Yeah.
I was met with the realities of a huge burden of disease, a lot of people that are sick, very limited resources. And then you have cultural barriers in terms of understanding of what disease is. And then you have challenges as well. I realized with aid coming in and like short-term mission trips that can
Hmm.
actually derail the work of the local ophthalmologists, in this case, or local doctors, because people then expect free care. People don't take responsibility for their health. And you find that if you're trying to build a system where you're employing locals to take care of their own people, the locals don't seek the care that they need to because they think, oh, in a few months, someone's going to come and do this all for free. So why would I
Hmm.
have to pay this relatively small amount that they're asking for my care? But at the same time, you have people who are really, really, really poor that don't have anything and they really can't afford anything. And so those people really do need free care. And so, how do you tease that out between those who can afford and those who can't? between people who, if you don't do anything at all, they'll go blind or stay blind, or, if they have more serious conditions, die, versus those who, like us, can pay to go get their glasses, or, can pay for, a medication to treat their condition, etc. So yeah, it's been very eye opening. Here at Loma Linda, where I work, we are developing our own global ophthalmology program. And
Okay.
Loma Linda itself is a mission based institution. So there's a lot of mission trips that are done. Medical students are encouraged to go on mission trips. Like when I was a fourth year medical student, the medicals actually supported me to go on my trip. So there's definitely a great fostering of lending a hand, lending our services, lending our expertise to those who need it most. So I think that's great. And so specifically for ophthalmology, I want to, I guess, foster that spirit into more specific partnerships where even if we don't go to a country anymore for whatever reason, we've helped develop their system so they can continue to care for their people because they are very capable. I would say one of the things I've been really impressed with in my travels. I've also spent some time working in Sierra Leone and then more recently in Fiji as well. Is they're very capable ophthalmologists and doctors everywhere. I think a lot of times we come back with stories from mission trips like, oh my gosh, they're just like so poor, they have nothing, like, and I think as humans in general, it makes us feel good to think we're meeting a need, which we
Right.
are. But I think sometimes we it makes us feel even better when we think we're the only ones that can do it, or like other people are just so helpless, we have to step in.
Mm,
But I think that narrative can be damaging because it doesn't aid in creating partnerships. When you want a partnership, there has to be some respect and somewhat of seeing someone as your equal.
right.
And so that kind of narrative really doesn't help foster that. And really, it's only in partnerships you can create sustainable change. So
Yeah.
I was personally impressed with the intelligence, the diligence, the dedication of these providers in all different parts of the world. In some ways, I think they should be congratulated even more for the work they do, considering the limited resources that they have. I
Agreed.
mean, in my training here, I've been afforded the latest and greatest in technology and equipment to make diagnoses and treat. And you have people who they're just going off physical exam or just going off the experience or the intuition. They're working with like dull blades and medications that are out, that expire, that don't work as well. And they're still finding a way to make it work. They're still finding a way to like restore vision and to help people get better. So I've been so impressed with that. And I just see like, man, look at this bright mind. If only they had the technology, if only they had extra education that they need, how much more could they do? And I think that's really where we can play a role is in empowering them to be able to do their best. So
Right. So basically, we need to shift from a savior complex or mentality towards more of like a partnership when we have these medical missions. Because if you're constantly viewing someone who has less resources than you and is doing the best they can as your inferior or as someone that you have come to save, then you're never actually going to make lasting change because you're temporary, whereas they're there in the community day to day. So they actually need to be the ones that are creating lasting change within the community.
absolutely, yeah, I 100%. And I think that's for the majority of places. You have some places where there's literally no one, absolutely no one. It's most impactful you go in there and doing something, even if it's just for a week or two, because otherwise no one will be there.
Right.
But I think the world is changing, with globalization, with the access to internet. Like when I was in Sierra Leone a few years ago, I was literally like in the bush, in the village with my grandma. We were walking to somewhere, there'd be nothing for miles, and I come across like a little hut with a little girl, and she's like listening to Rihanna on her cell phone. But this is
Uh,
this is like how our world has changed, right? Like people have access now, and so it's very rare to find a place where there's absolutely nothing happening and there's no care being given. Most places you do have people trying to meet their needs of their population. And so, yes, I think the burden is on us. And I say us being an American living here in the West, in our missions and in our effort to help the underserved, to focus more on partnerships um,
Okay.
rather than saving everyone.
Yeah. It reminds me of a story I read in the book Half the Sky. And they were talking about trying to end female genital mutilation. And they were saying that you can go there all day and tell the mothers and the fathers, stop cutting the genitalia off of your daughters. Like, it's bad for them. This is not helpful at all. But if you don't address the fact that a lot of the cultural norms is that the women will not get married. The men of the other village won't marry the women because they're saying that they're not snipped. Like, if you don't practice
Right.
FGM, you won't get married. So they're like, we actually need to address a whole cultural shift versus just saying, stop doing this. And I just feel like every time, when I was growing up, every time I thought about medical mission work or thought about doing it or watched people come and do it in Nigeria, it never, like, I never thought about the fact that it had to be like there needed to be a community change or a cultural shift. It was always like, oh, the white people are here, and
Mhm.
that just it actually damages your psyche because it's the whole white savior complex. It just keeps going, and now it's not just,
Mhm.
it doesn't have to be a white person. It just is the American, or the European savior
Right.
complex that just it's a
The
cycle.
foreigner.
Yes, yes,
Right.
you came from abroad,
Um,
that whole speech.
yes, yes. No, 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 that's so true. And so and that's why I think we need to highlight the work of the local people and what they're doing and empower them. And when you talk about changing a culture, that's so important because a lot of health has to do with mindsets and traditions and to really affect long because we know, I mean, yeah, there are health conditions that you address with surgery and then that's done. But a lot of majority of health has to do with lifestyle and addressing disease early. And if you think about the health of a population, a lot of that has to do with the mindset. And so, if you really want to change that, or if you even want to set up systems that can catch disease early or that can provide acute care when it's needed, you need the buy-in of the people that you're trying to meet, like that you're trying
Right.
to engage with. A lot of times, I like to believe the intention has been goodwill and people from the West go and do these things. I think, unfortunately, by the wayside, a lot of harm has also been done. And I think we can see over the years of there's a whole lot of school of thoughts about aid, specifically to Africa and how helpful it is and how much good are we really doing and kind of moving away from like just pouring in money to enabling people to generate their own money, through like
Right.
microfinancing and different things.
Yeah. Creating
And I think the same time,
infrastructure. It's different.
correct. It's like basically teaching a man to fish versus giving them the fish, right? But that's a lot harder to do. It takes building partnerships, which can be really hard because everyone has their own vision of how they want things to work. You have to come to compromise. And then sometimes it's difficult going to a different country and working. There's language barriers. Sometimes you meet people who are just really poor, right?
Right.
They're working, they're not getting paid by the government. So they look for every opportunity to get money. Like sometimes it's frustrating because you're like, but can you do your job? Do I have to quote unquote bribe you, give you extra money, or why are you trying to use this as an opportunity to enrich yourself? But then if you also understand where they're coming from, like they're also trying to feed their families, they're also trying to survive. And so there's all those challenges that you have to deal with. But
Yeah.
I think it's worth it if you can work through all of that to then create something that's sustainable. That's the challenge.
Yeah. Hopefully we're up to it. Hopefully. So I just have
Yeah.
one last question for you before I let you go. What advice do you have for any young person who is from Africa, in any country in Africa, like that's a young woman who wants to pursue a career in medicine? And do you have any tips for them, or do you have anything that you wish you had known before you started? And especially, and then just to add on to that, if the person is interested in going to medical mission work, is there anything that you would want them to know or any kind of encouragement that you would give them?
I say for someone who's interested in this, that's awesome. Like it's a really great field. It's a long, hard road, but it's worth it at the end. I would say the first thing is try to understand or talk to other people in the field as much as you can. Like we talked about mentorship earlier in this episode and the challenge in finding mentors that look like you. But I think you can find mentorship anywhere. It's great when it's someone that reflects you in some way, but just in general, just talking to doctors. Like I know for me, I was fortunate, like growing up, to see my uncle kind of in that role, but even just reading books nowadays with social media, YouTube, like you can
Yeah.
find a lot of people talking about medicine and the work they do. So I think the more you can understand what medicine is like and what the lives of doctors are like, the more helpful it can be. Study hard. It is a very intellectually challenging field. The earlier you can develop good study habits and skills, the better it's going to be for you. And I would say remember the reason why you want to do this. Like, hold on to that. I remember, I think it was in high school. Was it undergrad? Maybe it was undergrad. It was a Time magazine issue, and they were talking about healthcare specifically in Africa. And they had pictures of different people with different medical ailments, different hospitals, different organizations that were, doing work to, empower or increase access to care. And I was like, this is what I want to do. So I think it was early in college. I just took out those photos of the magazine and just had it with me. And it was a constant reminder. I think I finally got rid of it when I was going to residency. But that I had that with me for years. When it would get
Wow.
hard, when I'll get frustrated, when I feel like it may never happen, to remember the why. So I think holding on to the why is so important because that's what's gonna keep you passionate and remind you of why you're doing what you want to do. And in terms of medical missions, I think any is helpful. Like, I know I've kind of talked about some of the maybe unintended damages that can happen from short term missions. But I honestly think going out there, just getting out of your comfort zone, being somewhere where there may not be any electricity or hot water, where you may get bit by mosquitoes. Just that getting out there and understanding that there's a whole different world out there from what you experience is important.
Hmm.
And then I think, seeking organizations or working with organizations that have established presence in countries, most likely they're working within a system where there's a partnership and they're contributing to the work that's already being done, I think is also helpful. But just give it a try. It's just, I know for me it's a little bit different because I grew up outside of the US in a developing country, but just even being here for a while, you forget, you get comfortable. And every time I go, I'm always reminded of how blessed I am and how little I have to complain of. And I also feel challenged to do more. So
Right.
just get out there.
Okay. That was awesome. Thank you. Thank you
Sure.
for sharing and for the encouragement and for the information. I honestly had to Google the eye today because I was like, girl, you gotta, like, you really don't know much about the eye, just in case,
I
just
know.
to make sure.
Yeah, vision is it's just one of those things we take for granted. You wake up, you can see, right? So
Right.
when something goes wrong, though, it's a different story. So,
Yeah. I was like, what does the retina
um,
do? I was like, which part of the eye is colored again? Wait a second, like, what is this? And it's like, wow, the eye literally does transmit lights and convert, your brain converts it into information. It's insane. It's just
it's
insane.
incredible how it works.
Yeah.
I mean, the neurology of it is just so fascinating. So, yeah, it's a great field. And if anyone's listening and you're in medicine or thinking about medicine, I would say strongly consider ophthalmology. It's a wonderful field.
Yes. Yes. Especially if you're an African female, we need more female
Yeah.
ophthalmologists. Yeah.
We do. We definitely do. Just over the last few weeks, one of the ophthalmologists in Sierra Leone, Dr. Jalika Mustafa, has been recognized for the work she does. She's like the first, I would say, female ophthalmologist in Sierra Leone that's like the head of the National Eye Care Program, and she's young and she's energetic and she has vision. And I'm like, we need more people like this, that can really affect change. So I believe the future is female. Come on board. There's a lot of work to do.
Yes. And be encouraged. The going is hard, but you can absolutely do it as Jewel has shared with you today. So thank you, Jewel. Thank you so much for talking with me today, for hanging out with me. And I hope to have you on more
Right.
podcasts. One day
Sounds good.
I'll find a way to go on a medical mission that does not require me to touch or smell.
We can do that. We we can definitely. I mean, there's just so much to do. Yeah, you don't have to be around the grossness. But you know the beautiful thing about the eye too, there's not a lot of, well, certain parts of it. There's not a lot of gore, a lot of
Mm,
blood. So it's just
That's
the
what they
eye.
say. And then the
Yeah.
first time I walk into the room, it'd be like maggots crawling out of the eye. Nah, nah, I don't trust y'all. Doctors be lying. Mm-mm.
Oh, that's
Oh,
funny.
it's
It's rare,
nothing.
but it's possible.
See?
Sometimes you bring this on yourself. It will just be your luck.
And that's what I'm saying. Those kind of things always happen to me. I'm like, no, I'll bring you guys coffee. That's my thought. I'll just bring the tea, the coffee, the soda, whatever you guys need.
Oh,
That'll be my role.
there's so much need for pharmacy and medication, and
That's true.
just improving utilization and access. I mean, there's so much. So
Yeah. Doctors
uh,
Without Borders is always hiring pharmacists. Like they just always need help. So something to
mhm,
consider. I also don't
something
want
to
to get
consider.
shot. So
Well, they do tend to go in areas where things are a little bit,
dicey.
yeah,
Yeah.
a little dicey. You little dicey. So, but yeah, this calmer areas. We can also like, find some time to go to the beach and do relaxing things.
True. True.
While we're there, it doesn't
I'll
always
pray
have to
about
be
it.
really. Yeah, yeah,
Ask the Lord to reveal the path for mission
you
work.
will.
All right. I'm gonna let you go. Say hi to Auntie.
I will. You take care.
Oh, bye
Okay.
guys. Say bye to people.
Bye, everyone.